Thank you, Mr. President. Good morning again. September is also National Sickle Cell Awareness Month. Last year, around this time, I was able to donate blood at a drive hosted by the American Red Cross. And I know Kurt Luthi is here from the Red Cross, or his team. And they do great work all year round, but also particularly focus on tagging and making sure that there is available blood in the African American community that could be useful for sickle cell patients. Sickle cell disease is diagnosed at birth, and it's estimated that it occurs in about 1 of every 365 Black or African American births, and in about 1 of every 16,300 Hispanic American births. Less than 10% of Americans donate blood. It's a challenging issue for us. Talk about being prepared. But blood transfusions are one of the most critical treatments for sickle cell patients. It's even more important that Black African American residents donate blood. Sickle cell patients benefit most from blood transfusions from people of the same race or similar ethnicity, but only 5% of blood donors are Black. In some cases, sickle cell anemia can be cured through stem cell or bone marrow transplants. These are not done very often because of significant risks involved for the patient. Many people that carry the trait aren't even aware of it because it doesn't always cause illness. It's important that African Americans and people of African descent also get screened. That's a big message this month. I'd like to thank Ms. Janet Ricks, who you'll hear from shortly, a longtime Montgomery County resident who's with us, who has sickle cell anemia and is a strong advocate for fighting this disease. I'd also like to acknowledge the African American Health Program, which has done great work in the Black Physicians and Healthcare Network, along with the American Red Cross, who have played and continue to play a critical role in educating and treating members of our community who have sickle cell anemia. Right after I read the proclamation, per the Council President's guidance, we'll call up and have Kurt Luthi from the American Red Cross and the representatives from the African American Health Program. And if Ms. Ricks is with us, you're welcome to come up as well, anyone else who is there for this proclamation. So I'll turn to the proclamation and then we'll invite our guests. Whereas sickle cell disease, SCD, is an inherited blood disorder in which red blood cells may become sickle-shaped and harden. It is not contagious and there is no universal cure. And whereas September is Sickle Cell Awareness Month, a time to raise attention for the disease. This year's theme is Sickle Cell Matters. And whereas approximately 1 in 13 African Americans carry the sickle cell trait. Because the trait usually does not cause illness, many people do not know they have it. And whereas Latinos have the second most common incident of sickle cell disease in the United States, however, many people of many ethnic backgrounds have the disease as well. And whereas approximately 2,000 babies are born with SCD annually in the United States. For a baby to be born with SCD, both parents must carry a sickle cell trait or genes from another hemoglobin like HBC, HBE, or beta. On average, diagnosis is made at birth. And whereas sickle cell disease is a global health problem. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby declares September Sickle Cell Awareness Month, and be it further resolved that the Montgomery County urges its residents of African descent to be tested, and if they don't know their status, and all residents to advocate for better treatment, education, and research of this disease. Presented on this day, the 20th of September, in the year 2022, signed by myself and the Council President on behalf of all of us on the Council. So I'd like to welcome our guests.
Good morning to council members and all of the guests in the audience. I am so pleased to be here. I really am not prepared to speak, but I will say that the awareness that the council is asking for our community is very important, because the disease that I have can be self-cured if the two people who give birth to children will be aware that they are carrying the trait and don't need to have children, can adopt children or find other means in which we can resolve this issue. I am thankful to be here. I am 80 years old, in spite of the fact that one of the doctors did not want me to tell my age. I am pleased to be 80 years old because the life of sickle cell is 42. I had a sister who also had it. We both have sickle thalassemia, which is common to Mediterranean peoples. And my sister Carol lived for 2 weeks before her 60th birthday. So we are both prepared to speak on the topic of sickle cell, and they are making strides. I am proud to be able to say that I am still a living patient. Thank you.
Those were great comments and very impressive and so important. I do also want to thank Dr. Kroll, Dr. Bridgers, and the entire HHS and public health team for all your hard work and dedication in this important space. We will now take a picture.
Oh, Council President, I don't know if the AHP might want to.
My fault.
and Red Cross.
I just quickly want to introduce Dr. Marilyn Gaston, who is a pioneer in the research for sickle cell. Dr. Gaston.
Well, I too want to thank the County Council, Will Jawando, the entire council, and the council president for highlighting this important disease. You know, historically, it was totally ignored. It didn't receive any funding, no research was going on. And finally, in 1972, the history is important. In 1972, President Nixon, after the Black Panthers had visited him in the White House, once they learned about this disease, which is mainly in this country in the Black community. And so there's no question that it started getting attention, got funded, and I got involved in 1972. At that time, the life expectancy for a person born with sickle cell disease was 22 years of age. Funding was accomplished. We did a number of things. I was privileged to be able to help with major national funding. First of all, also at that time, the life expectancy was so low because our newborn babies under 3, were dying at great rates. In fact, they could have, from overwhelming septicemia or infection in the blood and in the body. And at that point, we decided we had to do something about that because it could be prevented, and no one had ever tried to do it previously. And so, like I said, I had the privilege of running a national program that first of all did a clinical trial documenting sickle cell disease at birth, putting them on prophylactic penicillin, and the data were so overwhelming in the trial, we had to stop it early because it was so clear penicillin was saving lives. So we did that. We went to the Hill. They gave money for newborn testing. Every state could do newborn testing. Because first we had to diagnose them, because back then they were being born with sickle cell disease and nobody even knew that they had sickle cell disease until they came in and died from septicemia. So at this point in time, we got the funding, a lot of programs across the country, a lot of more knowledge. People we didn't even know, doctors, I didn't learn in medical school about sickle cell disease. I didn't know anything about it. But now we have a bunch of knowledge programs. We're close to finding a cure, and we're sure that we can. And I thank you again for your emphasis.
Thank you.
So I do want to thank Councilmember Jawando, Council President, and County Executive. The Red Cross is honored to be partners with our community. This is a really easy way to save lives. And we encourage everybody who hasn't donated to come and donate blood. And we will continue to work with our partners to address this important issue. So thank you.
Thank you.
I'm feeling very inspired this morning. That was extraordinary. Dr. Gasson, thank you so much for that history lesson, which is so critically important. Thank you for your leadership, truly, on every level. So, I love it. And she's humble too. Look at that. All right, let's take that picture now. Thank you, everybody.